The recent decision by Queensland's LNP government to temporarily halt the prescription of puberty blockers and hormones for gender dysphoria treatment in minors has created significant challenges for young people seeking this care. The ensuing scramble for alternative solutions highlights the urgent need for a comprehensive and compassionate approach to this complex medical issue. The repercussions of this policy shift extend far beyond the immediate impact on affected children. It underscores a broader societal struggle to understand and address the needs of transgender and gender-diverse individuals. Liam's experience serves as a poignant example of the difficulties faced by young Queenslanders. He endured a year-long wait for treatment, only to be confronted with the abrupt implementation of a statewide ban. This exemplifies the already existing limitations in access to specialized care, particularly for those residing outside of major urban centers like Brisbane. The government's justification, an independent review into the use of these treatments while ostensibly aimed at ensuring patient safety, has inadvertently exacerbated existing systemic inequalities and created significant barriers to care. The timing of the announcement, coupled with the limited availability of private clinics, many already at capacity, and having closed their waiting lists prior to the directive, further compounds the problem. The immediate impact of the ban is felt most acutely by children awaiting their initial treatment. The government's claim that children already undergoing treatment will continue to receive care is a small comfort. The approximately 600 children currently on treatment plans will undoubtedly experience anxiety and uncertainty as the review unfolds. The distinction made regarding the continued prescription of puberty blockers for precocious puberty underscores the inherent contradiction and the potential for arbitrary application of the policy. The discrepancy highlights the lack of nuance in the government's approach, treating a complex medical condition impacting gender identity differently from a purely physiological condition. The limited number of healthcare providers equipped to offer this specialized care further exacerbates the situation. The Australian Professional Association for Trans Health, OSPATH, registry reveals a startling scarcity of resources. A mere 10 general practitioners statewide are listed as providers, with only 2 practicing outside of Brisbane. The even rarer availability of specialists underscores the critical lack of adequately trained professionals, underscoring the need for increased investment in education and training in this specialized area of medicine. This geographical disparity, coupled with the existing challenges in accessing care, creates an insurmountable obstacle for many young people, particularly those in regional or rural areas, effectively denying them equitable access to vital medical care. The implications of this policy extend far beyond the immediate access to hormones and puberty blockers. The holistic care required for transgender and gender-diverse youth necessitates a multidisciplinary approach involving psychiatrists, psychologists, and endocrinologists. The ban's focus on the specific medications risks neglecting the vital psychosocial support that is equally crucial for these young people's well-being. The psychological stress induced by navigating this complex medical situation, alongside the added challenges of societal stigma and potential family conflict, underscores the profound impact on mental health. This highlights the urgent need for a comprehensive approach, one that addresses both the physical and emotional needs of these children in a supportive and evidence-based manner. The government's decision has sparked widespread concern and criticism, with advocates arguing that the pause in treatment will lead to significant harm and further marginalize an already vulnerable population. The lengthy waiting times, coupled with the scarcity of providers, effectively denies many children access to timely and necessary medical intervention, potentially leading to irreversible negative consequences for their physical and mental health. The focus should be on expanding access to care, rather than restricting it. Investment in training more healthcare professionals, increasing the availability of specialized clinics, and implementing robust support systems are essential steps towards ensuring equitable access to gender-affirming care. A compassionate and evidence-based approach is paramount, one that prioritizes the well-being and rights of these children. The pause on treatment is a setback, delaying essential care and compounding existing inequalities. The need for a comprehensive review is undeniable, but this review must not come at the cost of the well-being of vulnerable young people awaiting critical medical intervention. The focus should remain on ensuring access to safe, timely, and appropriate care for all children, regardless of their gender identity. The longer this situation persists, the greater the harm inflicted upon those who need this care the most.